Hi, good morning. This is Theo Arvanitis, the C3-Cloud coordinator, and I would like to formally start the C3-Cloud conference this morning. Today, it is about the completion and the results of our project named Federated Collaborative Care and apologies, I have lost. Okay, it's about a federated collaborative care and cloud architecture for addressing the needs of multimorbidity and managing polypharmacy. This project has been running for 52 months. Officially, we will end the project on the 31st of August, and we started in 2016 when we were able to achieve the results of this call. Just to present to you the project partners, we have partners from Sweden, France, Spain, Germany, Turkey, and the United Kingdom, and all the partners will be discussing the results of the C3-Cloud project today. Just to give a quick overview, what is C3-Cloud? What we aim to do was to develop an ICT-enabled infrastructure to be able to coordinate patient-centered care activities and support clinicians, part of multidisciplinary care teams, in order to help patients who have chronic conditions and achieve what you'll hear throughout this conference, which is the concept of digitally enabled integrated care. C3-Cloud had quite ambitious objectives. As part of the exercise, we developed a lot of tools, know-how, and content that allow us to help practitioners and their patients to create collaboratively personalized care plans through the use also of systematic and semi-automatic reconciliation of clinical guidelines, which we created also in a computable form. Develop decision support throughout different tasks, in particular to identify risks, recommendations as part of the plans and the goals of the individual patients, to be able to understand drug interactions and hence help polypharmacy problems and achieve overall aims of patients to have better self-management of their care. We have done that by fusing multimodal data, and as you will see, we bring data from electronic healthcare records and other providers. We have done that through functions that allow us to put meaning into the data and also be able to do analysis of both the data and the clinical rules. And of course, at the center of everything has been the patient involvement through a personalized empowerment platform, which we will discuss further down the conference. And you will see that we have demonstrated the feasibility of our work through 3 pilot studies to look at a combination of chronic diseases, in particular diabetes, heart failure, renal failure, and depression in different comorbidity combinations in Spain, the UK, and Sweden. We have a very nice and packed conference today. I just wanted to go very quickly through the program and the approach we are going to follow. Firstly, for all the attendees, I would like to inform you that the whole conference is recorded for the purposes of the final report of our project and also the transcription of the proceedings. All attendees are muted and can collaborate during the discussion sessions by submitting questions in the question panel as part of the GoToWebinar. What you will see is during the sessions, the presenter will be visible, hopefully, and you will be able to see the slides as you see mine. And we'll try to cover different subjects in a succinct way, so we'll try to finish on time. We'll start with the first session in a moment after we have a welcome from our project officer, which will cover the societal challenge of multimorbidity and polypharmacy. And we have colleagues from University of Ghent, South Warwickshire, and University of Warwick. Robert, Chris, and George are going to be presenting together with me in this session. We'll move to the C3-Cloud solution demonstration, where we'll have an introduction of our view of digitally enhanced integrated care. And of course, you will see our assets and how they work. Then we'll have a coffee break. Then we'll go into interoperability of systems, where our colleagues, Catherine Kronaki from HSW International Foundation and Gökçe Benulalaci Tukmen from SRDC will discuss how international standards in terms of interoperability have been learned in other projects in our architectural and technical solution in C3-Cloud. Then before lunch break, we will have a session on clinical decision support with Thomas Bill giving us his view of the success factors for guideline and clinical decision support in task planning and EHRs. And then we'll have a presentation of what we achieved through GDL in C3-Cloud from our colleague Rong Chen from Cambio CDS. Then it will be a 3-quarter lunch break. And in the afternoon, we'll start with patient empowerment, when Nutram and Pontus Lidman will talk about aspects of self-management and the benefits and challenges of patient empowerment platforms. And finally, we have 2 more sessions. The session on information sharing and change management, where initially we will have an interesting combined discussion from Nathan Lee, Gunnar Klein, and in terms of protecting patient data. Tim Robbins will give us his perspective in terms of integrated diabetes care supported by digital tools. And he comes from University Hospitals Coventry and Warwickshire NHS Trust. And finally, Deepak Kalra, our colleague from Eurorec, will talk about our way of supporting organizational changes to get the best out of C3-Cloud. Finally, we'll talk about what is happening next. You will hear from Malte from Empirica about our evaluation results, representatives from our C3-Cloud pilot studies about health management and sustainability. I will talk about the future of our business and our current exploitation plans. And you'll hear about one of the research pollination projects that follows up from C3-Cloud, the AdLife project from our colleague Esteban from Kronigune. And hopefully we'll finish by 16:15 Central European Summertime with the conclusions of this conference. I think without any further ado, I would like to invite our project officer, Orestes Kaliagidis, who I would invite him to do the opening of the conference and give us his perspective of the challenge that C3-Cloud is trying to achieve.